Hi.
Um,
Oh,
Good.
hang on.
Let me
I think I messed
see.
this up.
Lovely Clinic or Sarah Tonks?
Oh my god, why?
Hello. There we go. Hang on. Let's see.
How do I add you? Oh, there we are.
There we
That's
go.
it. It's working.
Hello,
Yes.
hello. Hi,
Sorry, what
Sarah.
nightmare.
How are
I've never done it
you?
that way around before, so it confused me.
Okay. Yeah. How are you doing?
I'm good. You're right. Nice to
Good.
see you.
Yeah, I am fine. I'm fine. I've had my daily walk highlight to Whole Foods today
Oh.
to go for a supply run. So it's been all extremely exciting.
What did you buy?
How about you? I bought some mochi and
What?
I bought it's these wee Japanese ice cream things.
Ah, yeah.
Little moons. And I bought some blueberries for smoothies, and I bought burrata,
Wow.
my favorite cheese, and all the essentials
So
basically,
middle class.
and some champagne as well. So
Not at all basic.
everything that is required. So yeah, all the basic commodities that we need for this time. How about you? How's your day been?
Oh, I've just been doing some work actually. It's a blessing in
Yeah,
disguise.
yeah. Have you been out at all?
No, not today.
No.
I haven't. No.
Oh, I need to, get out for a wee while, get some fresh air. So yeah, how are you finding everything? It's all going okay, or
Life is good.
life in
The,
general?
the
Yeah,
dogs are
yeah.
thrilled that I'm home actually
I
all the
bet they
time.
are. I bet
Yeah,
they
they're
are.
loving it
Yeah.
right now.
Are they there with you at the moment?
Yes, one of them
Yeah.
is asleep at my feet, and I don't know where the other one is. She's
Yeah.
roaming around somewhere.
Yeah.
So, did you get any
Cool.
questions?
So I got quite a few questions actually. I've got them all written down here so that I didn't forget them. So how about you? You put questions on as well.
Yeah, but
A question box too.
I'm almost questionless, so you better go first.
Are you?
Yeah.
Okay. So the first one I got was, what fillers do you recommend for forehead lines? I don't know if you treat many forehead lines with fillers. I know that I don't do that very often, but it's. I mean, usually say Botox is obviously the first line thing to do for forehead lines.
Yeah.
Have you got any take on that at all?
So I normally use Juvederm Volite. I've got some reverb,
Yeah.
by the way, just there from you. Is your
Oh, you have?
Is your monitor off? Because otherwise they get reverb.
No, my monitor's on.
So no, I mean the sound.
Yeah. The sound. So what should I do?
Just make sure the sound on your computer's off. It'll be
Oh,
fine.
okay.
Yeah.
Yeah.
Okay.
That should be it.
So I tend to use Juvederm Volite.
Okay.
There.
Yeah.
Also, it depends if we're talking about like, is it just that they've got horizontal forehead lines, or is there a depression in the forehead as well?
I am not sure. It was a question from Instagram, so I'm not sure if it was for depressions or if it was just for general lines. I guess in those situations, if you had somebody with quite a depressed line in the forehead, what would you say? I mean, it is a balance between kind of relaxing the muscle, obviously, and then filling what's left, I guess. But I guess, and maybe in the cases where you've say tried Botox and or if you don't want to try Botox and because you're worried about risking ptosis and they've got quite deep lines there.
So I gotta tell you, I had my forehead done by Ewan probably about 2 months ago. Changed my life, really.
Did it?
Yeah,
okay.
it totally
with
changed my life.
with filler?
Yeah, with filler. Yeah. So we used a cannula.
What was the technique? A cannula.
Yeah.
Okay.
And it wasn't a pleasant experience.
Sure.
But I was really thrilled actually with the outcome. It was shocking what a huge difference it made to me.
Yeah.
So I'm totally down for having that done again.
Okay.
Give me that.
Sure.
Give me that beluga forehead. I want it round.
Sure. The round. Yeah, and that was just subdermally, or was that was kind of deep onto the periosteum, onto the bone.
Yeah, on the bone.
Yeah, on the bone. Okay,
Delicious.
yeah, nice splitting part of the connective tissue there.
It didn't hurt. It was just creepy, just really creepy kind of feeling.
And what type of filler did Ewan use for you there?
I think he put vol lift in, but I'm not entirely sure. Sorry.
Sure, yeah.
Typical, isn't it?
It's nice doing your due diligence there, Sarah. Fair enough. But it was a filler.
Yeah. I think it was hyaluronic acid. I'm just assuming.
Okay. Cool. Another question I had, is there any way of preventing Botox resistance in the long run? That's again a difficult one. That was from Complexion Me, which is I believe a sort of aesthetics site. Any tips on that? Or
yeah, Kish, our friend, is absolutely militant about not doing any more Botox within a 3-month window after they've had an adjustment. Like, it doesn't matter who it is. I could go to him and say, please, just do something for me.
Please just put more in. Yeah.
And he won't do it.
And he won't, yeah.
He just won't do it. He's so by the book. So they say, don't they, that the less exposure frequency you have, the less likely you are to become resistant. And certainly Ross, I don't know if Ross is watching. Certainly Ross, who works here as well, there was a period where before he came here he'd become a more resistant to it, so he had to go cold turkey. The other thing, I mean, do you change Botox brand in people who are I don't find that I do it's maybe use Dysport rather than Botox, I guess. That might be a way of it, but I think that you're right. Not overdoing it in terms of the distance between sessions is sort of what I mean is keeping the distance apart is probably key for that, rather than getting people come back every month for Botox or something. Cool. Another one. How often would you recommend having Botox? I mean, that's kind of covered. What type of filler can be used on the body? Which is your new thing. Well, so I know that I've already got you lined up to have your butt done, David.
Oh yes, yeah. I'm going to have my Kim Kardashian buttocks.
And why not? It's suitable for men and women. Anybody can do it.
Indeed. It is indeed. And actually, probably, the thing to have during quarantine as well.
Yeah, why not?
I would say,
let it all settle.
Come out with, exactly.
You were doing loads of squats while you were at home.
I've been doing squats every day. Yeah, exactly.
So there's 2 products that I'm using for that. So either Sculptra, which actually I'm using Sculptra anywhere pretty much on the body now for skin texture improvement, and that's working really well. I'm loving that at the moment. I did that on my inner thighs a few months ago, and that significantly improved the texture. Somebody likes your haircut.
Thank you, Daniela. It was definitely needed.
How did you get your haircut? Did you do that before the quarantine?
This is just pre-quarantine, just before everything happened. I was supporting a local business that's just literally around the corner, and they were totally empty, and I wore a mask, so
that's lucky.
It's all right.
Very lucky.
Very totally. Lucky. So you're saying you use Sculptra all over the body, and how do you inject that then?
Actually,
is it subcutaneous or is it again?
So I'm just diluting it quite a bit, maybe 12 to 15 mils, and then using a needle, not a cannula. I've just found that it's a lot easier to use a needle rather than a cannula. And
you do lots of micro droplets in an area?
I've never had a problem yet with granuloma formation or anything like that. Okay. And then there's another product as well called Genifil, which is hyaluronic acid, which you can put in the buttock as well. But I actually prefer the Sculptra out of the 2. But I think maybe the question about doing filler on the body, I mean, of course you can do any filler on the body, it's just for skin quality improvement. If you want to be doing, I don't know, sometimes I've done a Juvederm Volbella even for like in the knee maybe, or in the elbow. If you
just to get very pointy kneecaps.
For skin quality improvement.
Okay. Yeah. Cool. And do you ever use Profhilo in the body?
Yeah.
You know, I've got quite a few patients that love Profhilo, particularly on chest, decolletage, elbows, knees as well. Not for pointy kneecaps, but again for skin quality. I guess that's another.
I like Profhilo. I like it a lot.
Yeah.
But I think one of the reasons why it's so popular is because of the reduced number of injection points. So if you say to somebody, "Oh, I'm sorry, but you're going to need to have like 30 or 40 injections," of course they're going to be like, "Oh no, I don't want to do that. Give me the one that's got 10 instead." But the results of doing something like TSR density 1 or Nucleophil or Juvederm Volite, I think it might be better.
Okay.
But it's just harder for the person to have. Yeah. Somebody asked you a question, by the way.
Yeah, there's been a couple of questions come up. Let's go back. Best laser for rosacea, purple spider veins.
Oh, that's for you. I don't do laser.
That's for yeah. So I mean, for rosacea, I would say always maybe start with IPL rather than laser, and then there are some Q-switch lasers that you can use for spider veins if they're too big and they don't go away with IPL. But I'd usually start with IPL, which is much simpler, much kind of less painful, less downtime perhaps. So I'd say IPL is the first choice, and then if there's anything left to clear up, then maybe a Q-switched ND-YAG laser, or there's even ruby lasers and things that can be used to treat that as well. I've got a talk with Debbie Thomas, who Sarah's already done a chat with, but I think that is tomorrow, and we're going to talk all about different lasers, so maybe worth tuning in then. And then let's see what other questions we have. What would you recommend for somebody in the early 30s, never had an injectable or skin treatments? What skin treatments could be recommended for someone to start with a bat of the aging process? So,
well, first of all, Savsy, I got to tell you, I've got the hair transplant surgeon coming on tomorrow. You'll be thrilled to know, because you were asking about that before. Well, look, I just think by the time that you're in your early 30s, you've already lost volume. You've got to get in there. Mm-hmm. I'm probably a bit more aggressive, maybe, than you are.
I'll say Profhilo, so I'll say 20 mils of volume. But I agree. Usually there will be a bit of volume loss there that should be addressed.
Yeah, in all the classic areas. So you want to be looking at, the front part of the cheek here, the lateral cheek, the temple, the jawline, the chin. I'd look at all that. I think it just depends on the person, doesn't it?
For sure.
Treat what you see. But
totally.
Like the reality is though that people need volume replacement a lot earlier than they might think that they do need it. So somebody in their early 30s. You're already probably a good candidate for it. Sorry, I totally cut you off there. I think it's because there's a bit of a delay.
No. I was just gonna agree with you and say that some people in their early 30s look like they're in their early 20s, and some people look like they're in their late 30s or 40s. So yeah, I think you're right. It's very variable. I'd say that. I mean, obviously, if you've never done anything, then think about everything from the different layers of the skin, obviously, as well as important, addressing pigmentation, all of these things, and then fillers and Botox.
Correct.
Definitely in there.
I'm just laughing at what Ewan said. I took her forehead from a 1 to a 10. She's very lucky to have me.
Oh, you sure did. You sure did.
That's funny.
Yeah, I've never seen your forehead looking as good as that, Sarah.
Yeah, it's good, right? Look at that light reflex.
See. Exactly. Let's see. Have we spoken about pigmentation options yet? Not yet. I've got a question on that from somebody. What sort of products should I be using at the moment for pigmentation? I guess we could talk about that generally, what we'd use, and then what we can do at home for that. Because I guess there's in-clinic treatments which won't be possible at the moment, and there's some things that can be used at home. What would you say that your first line things are for pigmentation, Sarah?
I just want to jump in and say, Sabzi, you think that you look in your early 20s. Everybody thinks that, darling. Everybody. The reality can be very different. So for pigmentation, always home care stuff first. I'm a big fan. I know it's a bit retro, but I like the Obagi medical range.
Me too. That's my first line thing too, for sure. I like Obagi CRX for pigmentation, I have to say, rather than Obagi New Derm, but also big fan of Obagi. And any treatments?
I don't do laser. I tend to just treat them with home care stuff, and then if they need laser, then I send them on to Debbie, who will be on your stream tomorrow. So
I'll be there tomorrow. And what about peels and things like that? Do you do
again? So Kish does a bit of Cosmelan. So if they're going to need some peeling, then I will send them over to Kish. But it's just not my passion.
Yeah, it's not you. You're not a fan of peeling people's skin.
I don't feel it. No, I don't feel it. Maybe the perfect peel. Sometimes I'll do that.
Yeah, I think that's a good one.
It's like the lazy person's choice, though, isn't it? Because you don't have to think about much. You just slap it on.
Paint it on. It's actually, I've had that done myself. I really like it.
Me too. I've got it on now.
You do?
On my back.
And your face is an orange. On your back. So you've got an orange face. An orange back, rather.
No, I love that because you just like frosting. What frosting? We don't have to worry about that. No problem. Just put 3 layers on, you'll be fine.
Exactly. So let's see. And then retinoids, obviously. Somebody's asking, if your skin is too sensitive for retinoids, why are some other skincare alternatives for wrinkles? So there's quite a lot, I guess. There's vitamin C. There's bakuchiol as well, which is like a retinol alternative, which tends to cause less sensitivity and less redness. It can cause dryness, and other things like growth factors, peptides, stuff like that in skincare. I think with retinoids, almost everybody will be sensitive at a particular level, so it's important to maybe start with a very gentle one to begin with, like retinol palmitate or something, and then building that up. What would you say, Sarah?
I have nothing to add, but I do have a question from YouTube, which is, can you have fillers on the decolletage? Or is it too painful? Yeah. Of course, that's like bread and butter.
Of course, pain is not something that would stop Sarah or me doing these things. But it's possible.
The more it hurts, the better.
Yeah, basically. What would you recommend for someone in their 40s? Would you recommend threads or HIFU? You are the experts. What would you say, Sarah?
Okay.
Threads?
Right.
I hate.
I'm just going to say, I had Ultracell Q, the new one. Recently, they brought it around for me to have a look, and I loved it. I thought it was amazing. Took immediately 2 or 3 years off. I know that doesn't sound like a lot, but every 6 months counts when you're approaching our age. So I'm definitely going to get that device when everything's opened up again. So I think ultrasound is good. Threads, I like the monos. I think that the suspension threads are probably a lot more hassle than they're worth. And as well, the regulations have changed in England, if you guys didn't know at home. So it means that we can't just do them in office as we used to be able to do. So we're not doing threads anymore, which I'm not crying about.
Thanks,
I'm not that upset about it. Are you?
No, not. I'm just laughing at what Ewan said.
What you said?
We both look good for 60. Yeah, it's true. Thanks, Ewan.
Thanks, Ewan.
So the suspension threads, like Silhouette Softs and stuff. Yeah, I've never really been a major fan. I didn't find the results are really worth it, and also, the risk. I saw one person came to see me who had threads, who had a facial nerve injury, and after that, I was just like, I'm not going to touch threads with a barge pole. So, but anyway, HIFU is good. You've had HIFU, haven't you, Sarah?
Like 1 million times.
Yeah, 1 million times. Yeah. Okay, and just look at her. So it's so obviously works very well. I've tried it under here actually. I did a test with I was trying therapy, and I didn't find it particularly painful. I don't know about you. Everybody goes on about how painful it is. I didn't find it too bad at all.
They've got new protocols anyway for Ulthera. Plus, as well, I think they're using on thin people. Well, you get lipolysis. So it doesn't make any sense to me. You want somebody who's got a fuller face, and for those people, it works really well.
Yeah, totally.
How old are you, David? You must tell us.
How old am I? What age do you think I am?
No,
not 60.
I know, so I'm not.
Yeah.
The game away.
What age does the audience think I am?
Sorry, go on.
Yeah. No, I'm 35. 35, mid-30s. So yeah, a lot of people think I'm maybe 40, but I'm not. Can you use Aqualyx on lower abdominal fat or back fat? Absolutely.
Yeah.
You can.
I just want to say I prefer using Celluform. I found the swelling is a lot less.
Yeah, I remember you saying
than with Aqualyx.
Yeah. You can use it anywhere that there's fat, basically. I think I don't know what your results have been like. Have you done many kind of lower backs or anything?
I think it's good. It's good, but you need to be consistent, don't you? You know, one isn't just going to be enough. Tomo, that's the filter. Sure. It's a filter.
It's a filter. This is everything. My jawline is actually down here with my Kim Kardashian filter. Let's see. We had another couple of questions. There was one about I'm 27 and I use the ZO skincare range, which I like, but I'm looking for an in-clinic option to rejuvenate my skin, but something more than hydrofacial. Suggestions, Sarah, in-clinic treatments, there's so many. I think if someone's injection naive, then I love Profhilo.
Yeah.
And so you're a fan of T-cell Density 2 as well for kind of skin rejuvenation. I guess if there's a specific issue like pigmentation or something, then there's other treatments, as we've talked about, things like Perfect Peel and IPL and stuff. Would be a good kind of first line clinic option if you're treatment naive.
Just have fillers.
Just have fillers. Okay, yeah. Or there's just this is a
little in-joke between David and I.
Why piss around with anything else when you can just go with the Voluma or Volux everywhere.
So Volux, for those guys of you who maybe don't know, Volux is Allergan's new Juvederm filler, and it's for jawlines and chin, so it's quite a robust product. It's very heavy. It gives you a lot of lifting. Somebody has asked about necklines in your early 20s.
Yep.
Let's see. Well, I guess Profhilo, Volite, Redensity 1. Anything else you'd be doing?
For jawline for 20s.
No, neckline.
Neckline.
Yeah.
In the 20s. I mean, unlikely. I mean, again, Profhilo. Maybe, you could, if there is any ptosis there, I would maybe consider some radiofrequency, something like Forma, which is a non-ablative radiofrequency treatment we do. Other than that, again, like 20s, early 30s, maybe some jawline filler.
So, just on that topic, Ewan was just asking about your Morpheus 8. How was it?
Yes. My Morpheus 8, it was great, and I've never had as many comments on my skin, and even now I feel like my skin has changed quite significantly with it. It's not the most pleasant treatment to have done, I would say, but in terms of effectiveness, I think it's pretty good. The skin feels much more even. Reduction in pore size, and also I did it under here as well for just a wee fat pad under there, and that has really helped. And a lot of people have actually said, like, Claire has just come to my face like it's chiseled. I've not had any filler for a long time, but just really Morpheus 8. But I think that is possibly an effect of Morpheus 8 as well. And then we'll do all the TLC people will come and we'll just do Morpheus 8 one by one. So yeah.
I just had a question on YouTube about filler for wrinkled knee and skin and elbows. We actually talked about that, Dave. maybe you didn't hear, we were just talking about using like Juvederm Volite or Profhilo or Redensity 1, or maybe even like really dilute Sculpture in there, and softening the definition of muscular, lean, old people. Or is that too crazy? Nothing's too crazy here. Nothing's too crazy.
Nothing is.
I don't know. How would you do that?
I think probably Profhilo, and I mean, what I often do actually is combine Morpheus 8 with Profhilo if it's kind of skin laxity and very, very fine, crepey skin. It seems to work quite nicely. So doing say 3 Morpheus 8 sessions a month apart and doing 2 Profhilos in the weeks in between, that seems to work quite nicely. And then for building up quadriceps, just 500 mils of Voluma. Is the other option, and that will sort out all your knee wrinkle problems. But seriously, no, Morpheus 8, I think, would be my things to do for that.
I'm gonna try this Morpheus 8. Are you using that on scarring?
Yeah. Scarring, acne scarring, even active acne you can use it on, and surgical scars. Quite a lot of people who've had pregnancies and C-sections that have got kind of that wrinkly, very stretched skin. It can work quite nicely as well. Let's see.
Did you see the question about start of turkey neck, not overweight, just turned 40? What can I do?
Oh yes, just to start, I think for this, Profhilo and Morpheus 8 is a great combination. You have Ultracell as well, Sarah, which I don't know what your experience of that on the neck is.
Cracking.
That might be another thing. Yeah. So I think all of these things that are collagen stimulating, the sort of biostimulation treatments are the thing to do, because the neck is obviously really difficult. You can't really fill it. Jawline filler will only go so far. And if you've got that lax skin with very little support underneath it, then it's really just about building up the elasticity and collagen in the tissues. So things like Morpheus 8, Profhilo, and at the deeper level on the muscle layer, things like Ultracell.
Of course, if there's a bit of fat there, you can always use Celluform there as well. But people often ask, am I going to have loose skin after I do these fat loss treatments or cool sculpting? God, I just bought that. It's still sat in its wrapping upstairs. I've got these 2 machines.
Tell me about it, Sarah.
Dying to go.
About that machine. It's rearing to freeze some fat.
So that's another option for you. Maybe you could come and be the first one.
Yeah, totally. So there's that, and also actually another thing about Morpheus 8 is you can set the pins to 4 millimeters, so it can actually get into the fat as well and cause some fibrosis in that layer. So it sounds brutal. If you inject local anesthetic, it's okay. And there's ways of kind of setting it so that you triple stack the pulses so that you're really getting quite significant tightening in that layer.
That sounds painful.
It's a wee bit painful. It's worth it. Like we said, no pain, no gain. Will skin boosters be a good option for skin rejuvenation? I don't want to plump like filler does. So things like Profhilo, I guess, would be classified as a skin booster. Then there's the Restylane boosters as well, and TSO Redensity 1 is another skin booster. So all of these things can definitely help.
I got to tell you about this non-hyaluronic acid skin booster that we've been trialing recently, and I'm loving it. So it's from Cabo Italia. It's called Nuclear Fill, and it's got polynucleotides in it, right? And Kish and I we've tried it, and I love it. So, sometimes with patients who maybe don't have great lymphatic drainage and they have Profhilo, sometimes they can look a bit puffy afterwards because of the retention of the water. I've never seen that with the Nuclear Fill. Yeah, I mean, early days with it, but...
So what is in Nuclear Fill?
Polynucleotides. So, the building blocks of the DNA
of the guys at home.
It contains that. And I didn't realise that these are apparently very powerful antioxidants, so it's got the same kind of collagen stimulating ability that you find with the hyaluronic acid products, but you can use it in different areas. So, for example, these concertina lines, if you put Profhilo in there, sometimes it can look a bit heavy, I find. But the nucleophil, I've been loving it. I don't know if Kish and Ewan are watching right now, if they've abandoned and jumped ship, but I'm sure that they could chip in and agree with me. Agree. I don't think he's going to. Anyway, but it's good. Did you see, by the way, that somebody asked a question about what supplements you were taking? I know you've got your supplement range, so maybe you could...
Yes, of course. I am taking many supplements. I've got one here, which is my skin shake, which is protein shake with things like vitamin C, B vitamins, matcha green tea, adaptogens, maca, all of these sort of things, which are all kind of designed to boost the skin from inside. I think that's super important to just give all of the building blocks for the skin to repair itself, particularly after treatments such as Morpheus 8, where your skin is slightly inflamed and injured. So your skin will kind of soak these things up really nicely. Plenty of antioxidants is the key. Vitamin C in particular, together with vitamin E, are the ones that I would say to take. And then things like omega-3 as well for the skin. In terms of evidence for supplements in the skin, the only things that really have actual substantial clinical evidence are vitamin C, vitamin E, lycopene, and omega-3. And there's a few others that are kind of like sort of layer below that in terms of evidence, things like glutathione, and they're sort of on the fence about collagen supplements. I don't know what your opinion is on that, Sarah.
I like collagen supplements actually.
Yeah.
Because they're some of them anyway, are classified as a medical food in the States. So they're used for people, for example, who've got arthritis. That can't be a bad thing.
I think a lot of it is to do with the vitamins they contain as well as the collagen, though, rather than the tripeptides.
Can you hold up your product to your
of course
on YouTube?
This one,
because they can't see
the skin shake
that way a bit. No, that's it. Yeah, okay, thank you.
Job. No problem. Not used to doing these double screens. So.
Actually, somebody just asked me a question on YouTube. It's a head scratcher. It says, new MRI research shows hyaluronic acid lasts a lot longer than previously thought.
I saw that.
And can migrate. Thoughts?
Yeah, I think that you would. I mean, I saw that as well, actually. I can't remember where I was reading about it. But I think that, I mean, if it's just hyaluronic acid that's there for a slightly longer period of time, that's not necessarily an issue. And you will break it down over time, maybe just not the amount of time that is kind of quoted. I think migration, we've always known migration can happen, I think, clinically. So I guess you just deal with that if it happens.
Yeah.
What's your take on it, Sarah?
Totally agree. Yeah, totally agree.
Yeah.
So I've never been worried for myself about having migration because we could just get rid of it if it's a problem.
Yeah.
I think the fact that it lasts maybe a bit longer than previously thought, I guess, I don't know, it sounds like a good thing rather than a bad thing.
Yeah, I totally agree.
Yeah, I think it just depends where it is. And I think this is actually a good argument to have somebody who's good injecting you, because if it's therefore in the wrong place, it's not going to maybe break down that quickly. And in my experience, I've seen patients who maybe have had a bit of dodgy lip filler done, and we have this conversation, do you want to get rid of it? No, I'd rather wait till it's broken down. Then 18 months later it still looks the same.
Yeah, exactly. Yeah. So I agree. Yeah, there's always the argument for that, I think. What else do we have? Kish is loving the double whammy of Profhilo and Synikos, and I've been doing. Also, Ewan's been doing the nucleophil as well.
Treatments.
So you would. On you go.
Treatments are the way forward. No one wants to look like they have an artificially filled face anymore. It's aging. Do you mean like energy-based treatments? I don't know. let's wait for this person to get back to us. Sorry, go on.
Yeah. No, I was just going to say, somebody asked about would skin supplements help improve acne?
Yeah.
I think so. Yeah, for sure. I think there's some actually that are specifically designed for acne, particularly probiotics, and also there's also the argument for kind of not like cutting out dairy and things, so having more of a plant-based diet. So there's supplements that can kind of help you with that, I guess. What do you think? Any others? And also like high antioxidant supplements as well. So things like vitamin C, glutathione, vitamin E, all of these sort of things. What would you say, Sarah?
You're the one with the skincare range. I'm gonna bow to you.
So I think any sort of supplement that's high in antioxidants and is not from a cow, basically. So avoid things like whey protein. Zinc as well. Micronutrients like magnesium, selenium, all the trace metals can help as well. Retinol, vitamin A supplements too. And sort of saying lycopene is the thing that has evidence for it. So
I like Ewan's question. You can only use one filler ever again. Choose
Juvederm Voluma.
Really?
Yeah, it's my favorite.
Would it be?
I use it for everything.
Yeah. I think if we were going to go with Juvederm, it would be that. Or maybe Bellatero Volume.
I really use that. Yeah, I've not tried that one.
I like that one as well. It's
good.
Yeah.
Cool. And then, what are your thoughts on brands like The Ordinary that sell retinol and salicylic acid? Are these products any good from cheaper brands than like this? Yeah, they're good. Yeah, I quite like The Ordinary. What are your thoughts, Sarah?
I think, so my issue with something like that is it's maybe not the active ingredient that's the problem, it's the other stuff that goes into it as well.
Preservatives and stuff.
Yeah. So maybe with some of the other products, like for example, I don't know, an Illumier retinol, for the sake of argument, so it's also got niacinamide in it as well. It's going to have some aloe in there as well, which helps reduce inflammation. So you're not just purchasing the retinol, you're purchasing the carrier and you're purchasing all the other bits that go along with it too.
Yeah, I agree completely. I think I think it's good that cheaper brands are doing these things for sure, because it does make them more accessible and everything. But I agree. I think sometimes with more medical grade products, you know that you're getting like a good formula that's going to be less risk of irritation and things because of other additives and preservatives and these sort of things. So yeah. Totally. Let's see. I think sometimes the only thing I'd say about The Ordinary is sometimes the ingredients are quite strong as well, particularly with like high levels of salicylic acid and stuff that I've seen people use them on a daily basis, which is not necessarily appropriate either. Things like glycolic acid, salicylic acid, retinols, and using them all every single day and getting their skin really stripped back. I don't think that's a good idea, that it's that accessible, that these things are potentially cause damage, or they're maybe not being used in the way that normally a doctor would tell people to use them. But
that's true.
Yeah. Anyway, Botox is a good treatment to glabella with deep lines. Yes, for sure. What else? David, do you prefer skin treatments to fillers, injectables? Sarah, I watch you on YouTube, so I know your answer. And if you've been watching earlier today, then the answer is very clear about that. So yeah, I love Botox and fillers. Don't get me wrong. It's what I do every day, day in, day out. And yeah, I think they're great. But it's just it's good to talk about other things as well, because it's limited how much you can say about Botox and fillers, I guess, because most people know all about them. You don't think so?
Limited.
So let's see. Amanda saying, I'm 50 and have sensitive skin rosacea. I had a time with the lovely David, but wonder whether lactic acid would be too much. Not necessarily. It depends what strength of lactic acid and how often you're using it. Lactic acid is quite nice to hydrate the skin, so It's not something that I would necessarily say to completely avoid. The thing to use for rosacea is usually azelaic acid, and that can help reduce redness and treat dry skin as well. Anything else on that, Sarah?
No.
No. Is it true that forehead Botox can be too heavy and make your brows drop?
Yeah.
Yep. Yeah, it can indeed. Yeah. So what you tend to find is as people age and their forehead, they lose volume, as Sarah was saying, from the forehead. What happens is you lose some of the normal support from here. So your forehead sometimes goes into overdrive and starts creating these wrinkles. Then as soon as you put Botox in there, what can happen is that muscle that's there supporting the eyebrows just relaxes. So you get this drop. And that's the case with even younger people sometimes.
Yeah. So sometimes if a younger person notices that when they're having Botox and they're getting this drop, are you doing anything specific to kind of combat that, or?
Well, the things that I would always kind of try to treat in the glabella and the lateral part of the eyes as well, just to give as much elevation there as possible, and then do just a very low dose in the forehead, quite high up. That would usually be my take for younger people.
Pretty much what I do as well.
Yeah.
Somebody asked about eyebrow asymmetry with filler. Is it fixable? It kind of depends, I think, on the degree of asymmetry. Sometimes you can do it with Botox, actually. But then, of course, you're kind of left. So say, for example, you've got one eyebrow up here and one down there, and then you do the Botox in a certain way to even them out. But then it means that the one that you've kind of elevated, you'll often still have small lines here. So it's a bit of a trade-off. You then have to like train yourself to not raise up your eyebrows so that then you don't notice it.
So many a whole can of worms.
Yeah.
So I think that the thing to realize is that like everybody's forehead is slightly asymmetric, and like having fillers in the forehead will obviously amplify any asymmetry that's there. I guess that's and we're never going to be able to completely symmetrize a face, I think.
So Ewan's just emphasizing how fantastic I am by saying that the filler in his eyebrows was marvelous and the best thing that he's ever seen.
Yeah.
So I think especially for men, because it gives a much more masculine look, actually, having a bit more prominence in the brow bone.
Yeah, for sure. Not like oops. Oops, I just dropped my laptop there. not like me with my completely paralyzed forehead. At the moment, I quickly doing Botox before I left the clinic a week past on Friday. Somebody's asking, with my skincare line, do you have a set cleanser, serum, or moisturizer you'd recommend for all skin types? So it's very simple. My line has 3 basic products. There's a serum, there's a moisturizer, and then there's night cream suitable for all skin types and all skin issues and things. It's kind of designed as the base, and then you can kind of add things to it. I don't have cleansers yet, but they'll hopefully be coming very soon. Obviously, with everything going on, there's a bit of a delay in manufacturing and everything, but we have some in the pipeline.
Someone made a great point about having Botox done in the crow's feet area twice. And both times the results were good, but only lasted about a month. Is it because I'm a man? Well, I would say sometimes it can be, because you often need to use a higher dose in men.
For sure.
And Botox is dose responsive. So the more you put in, the longer it will last for and the bigger effect that you have. So say you're just doing half a dose, it might still look for the first month like a full dose can do, but it won't last as long. So it could be, So in that case, I typically double by half. Is that the right way to put it? No, increase by 50%.
Yes, you do 1.5 times.
Yes, that's right. That's what I'm trying to say. And see how that goes.
Yeah. I guess the other thing around the eyes is that some people don't realize that if you're treating the eyes, you wouldn't necessarily go kind of low down. And sometimes when people think, the Botox hasn't worked, and they've still got lines down here, but that's more because of the mouth levator muscles pushing the volume of the cheek up. So sometimes it's a volume thing as well. I mean, and it's replacing a little bit of volume on the cheek can sometimes help. And that's what I often do.
Sabzi asked this great question about Kylie Jenner's lips. She says you can blatantly see she's had filler versus Kim Kardashian. It doesn't look so obvious. Does this depend on what lips you have to start with or the technique? Listen, Kylie Jenner's lips are awful. Like, ask anybody who does injections, they will tell you the same thing. It's too much. And it's a horrible product, whatever they've used, and they've just used too much of it. And if you see her without makeup on, which I haven't, but I can tell you now, without makeup on, it would look hideous. The only reason it looks halfway decent is because she's got loads of lipstick on. So, but without, it would look awful, really. So, and she's got this migration as well outside the lip line too, which is just okay, you've got me started now. I've been like triggered. I need to calm down. You can take it from there.
Yeah, okay. I agree, Sarah. I agree. I think this is a shame. It doesn't look great. Then what else? How long does Profhilo last? Profhilo lasts usually, I mean, they say about 6 months. I do it myself every 6 weeks. So, but I think that's probably maybe my OCD. But I think it should last for a couple of months, and then the kind of collagen stimulating effect takes about 3 to 6 months to show the final results. And usually I'd say repeat the treatment every 6 months. I don't know, what do you do every 3 months for people, Sarah? Or
it depends, doesn't it?
It depends. Yeah, you can kind of do it almost as much as you like. Let's see. Has Jennifer Lopez done work? Yeah, I think so. Yeah, I think it's very unlikely that she hasn't done anything.
David, how can you say that? How can I mean, she's Latino, and they age so well.
I might be right. I'll take a bet on that, Sarah. If you think she's done nothing.
No, that would be one bet I would not take.
Somebody's asking, what's your opinion on HIFU for the face?
Love it.
Sarah,
if you've got a full face, it's good. If you've got a skinny face, it's bad.
Yeah. Does Botox eliminate the 11 lines once they're formed? Not necessarily. If you've had deep 11 lines there for a long time, and the skin is that you've lost collagen and elastin in the dermis of the skin, you're not necessarily going to get rid of them when you relax the muscle. So sometimes you need to do some filler in that case. So what I don't know, you'll probably do the same as me, Sarah. Botox first, and 2 weeks later some filler.
Yeah, although I try not to, unless I really have to. Although people do lose volume, don't they?
For sure.
Yeah. So, great comment from Ewan, who, just because I'm recording this on YouTube as well, said he's going to forward this to Simon Orion. So go ahead, please. And then he also said, I heard J-Lo just stays really well hydrated and uses essential oils.
Yeah, that's and aloe vera. Yeah.
She probably buys them off Goop, I think.
Yeah. With some crystals as well.
Yeah.
And the crystals on the forehead and cheeks as she sleeps.
For her vagina.
Yeah. Or the vaginal crystals. Yeah. Is a chemical brow lift less effective than using dermal filler, the cat eye? I think chemical brow lift is using fillers and Botox. I suppose traditionally, it would be Botox, wouldn't it? Right, but I think with filler, sometimes it can make it look heavier. It depends on how it's done and your pre-existing what you've got beforehand. Look, I think if you want to get that look, I think you just need to do a brow lift. For sure.
Yeah, and young people are doing it younger and.
I think it's Gigi Hadid and people have had brow lifts. Yeah. So, in their 20s, I think. And thank you, Amanda. Just saying about her lips. Can you do an eyebrow lift with Botox and fillers? Absolutely. You'd use a combination of Botox lift here, and then probably temple fillers. I don't know what do you do fillers in the hairline as well, Sarah? Yes. Yeah. When clinics will be back to normal, who knows? Oh, Sarah, you're open tomorrow? Yeah, I decided just
doing it in the garden.
Yeah, that's what my landlord's trying to make us do. So, really? But apparently, the building is fully operational. Obviously, expecting a rent in. So yeah, but I will not be going in for a while.
That's crazy. God, some people are just the worst.
Let's see. For hollowed eyes and fine skin, other treatments other than tear trough filler.
PRP, you could try.
PRP,
therapy, you could try.
You like PRP?
I like PRP.
Yeah. How much is the brow lift and what's with the fox eye thing? Brow lifts will probably be about 4,000 to 5,000, something like that, I would imagine.
Yeah.
What do you think?
Roughly. I guess it depends on who does it, doesn't it?
Yeah, totally.
Can there still be vertical lines on the forehead after having Botox?
Yeah.
Can you prevent them be a lower dose? Don't understand. But yes, you can still have vertical lines on the forehead.
You can, for sure.
After having Botox, because it just depends. I always say it's like a pair of shoes. You know, if you keep wearing them, you've got a crease across the toe. And then, yes, I am hungry. Yeah, dinner time. Yeah. And you can put as much shoe polish on or whatever afterwards. That crease is still there.
Yeah. So filler would be the thing to do.
Well, somebody that just asked there, can you use threads instead for a brow lift? You can, but like we were saying before, we're not really loving the long-term results. Or even medium-term results from having suspension threads. And in any case, we can't do them anymore here.
Yeah.
So what are you going to do?
Yeah, totally. Then, is there a skin peel for dark circles, like inner peel, lips and eyes? That will help. The one, I do the perfect peel. I do it right up to the eyes, and you just do one coat directly under the eyes. That can maybe help. What else for under eye dark circles? Carboxy therapy.
Light
eyes,
and light
carboxy
eyes.
as well.
So light eyes got glutathione and vitamin C in it. It's just mesotherapy, and it definitely lightens the skin. Waffle and Sunday are on the floor, Claire. They're passed out.
Cool. Anything else there?
Somebody else asked over on YouTube, I would like to know length of time hyaluronic acid lasts in the latest studies. I don't think there have been any sort of latest studies on that, because how can you follow it up?
I wonder, I mean, there was that thing the person said about earlier on about the MRI study, but I'm not sure what the figures are on that or actually how it's been done.
Yeah.
So, but I know that there are some hyaluronic acid, well, there's Juvederm Volux is supposed to last for 24 months, so...
Are you doing virtual consultations, David?
Not as yet. I probably will do some, depending how long this goes on for. Haven't decided yet. Are you?
Well, I've got a couple booked in, but I'm kind of... You know, when you're not in the...
It's difficult, though.
It's hard because you're not in the right zone either. When you're at work, you've got all your stuff there. You're in the mood for it. When you're at home, you're just having a cup of tea and then you've got to call somebody and you're like...
and you can't actually see people properly, I think. So, I think it's very difficult to do that effectively.
Yeah, it's tricky.
Yeah. So, I don't know. I haven't decided on that one.
So... Kish is doing some for hormone stuff, but I suppose that's a bit different.
Slightly different. It's more symptomatic. It's right what you're saying about just you're sitting and you're on the wrong side. Like even some of these questions that this treatment stuff thing. I just wouldn't even come to mind. But if the machine is sitting there, then I'd remember them. But sitting in my living room is not the same case.
No, it's really difficult in your pants. Wearing a
totally,
shirt in your boxes.
Exactly. Just make sure you don't stand up. That's for the OnlyFans rather than Instagram. So,
how did you know that I was following you on there? How did you know?
Oh, Sarah. Yeah. I noticed that you paid quite a lot on my account. So yeah, that's why
it's
yeah, totally.
You asked a great question.
Yeah, what's that?
Are you guys scared of aging?
Terrified. Yeah, there's never a week or a day goes past that you don't think about it. More death than anything else, to be honest. But that goes hand in hand.
I realised today that I actually have 2 life insurance policies, which seems a bit overkill.
Oh, really? Yeah. But you don't get that until you die, though.
No, I know. It's pointless for me.
It's totally pointless. Then Claire's asking, instead of Barry's boot camp, what are you doing to keep fit? I've talked to Claire a lot about my Barry's obsession in the past. I'm still doing Barry's. They're doing lots of really good Instagram lives. They're doing 4 each day. And then also American Barry's Bootcamp is also doing Instagram lives as well at 8 p.m, which would be, I think, from LA time. That would be like midday or something. So if you're looking for an exercise class, I would thoroughly. And then also some of the Barry's trainers are doing classes themselves as well.
It's quite good because then you can just slink out at the back and nobody is going to humiliate you publicly. Because you're at home.
Exactly.
So they'll never know. You'll never have to wear the vest of shame.
Exactly. And then, what else was there? There's a couple of other questions there. At-home LED masks, do you think over time red light helps with anti-aging? Do you use this? I don't use it. Do you, Sarah?
I don't use it. Debbie uses it a lot. But with this low-level light laser stuff, like the bionic, I think there have been some studies showing that it reduces inflammation. So I can see an argument for using it post-treatment. On that subject, I've been trying the Thor Claw, the one that's been sold by Health Exchange at the moment. And they say that reduces inflammation. And I've got to tell you, I have used it post-treatment, and I think it does. Because the immediate redness afterwards seems to be less. Whether or not that's actually clinically enough, is it relevant, I don't know, but certainly there seems to be a difference in the color.
Interesting. I think it's true. I think there is actually some growing evidence to support the use of LED. Whether or not these home masks are strong enough, I think, for them to really, unless you're going to be doing it super regularly, then it's, once or twice probably isn't going to do that much. But yeah, the ones that I think are quite good are the ones that I don't know if the one that you have, Sarah, is like one of these things that sits over your head. I think those ones are quite good because they've got lots of bulbs. But I think some of the smaller face mask things are a bit of a waste of time.
I don't have one. I just use Debbie's if I need to use it.
Yeah, I tried one for my brand actually. I was looking at a few different manufacturers. They sent them. They're all like super heavy on the face, and it gets quite uncomfortable after a couple of minutes with that on. So I think definitely these ones that are like structures with loads and loads of lights are probably the best thing to do. They're a bit more expensive.
We're going to get cut off in a minute because it's nearly been an hour. It cuts
an hour. Okay.
It cuts you off after an hour. Botox is overrated. It will never make headlines.
Oh, it's true.
Oh, that's
such
funny.
a waste of time. Yeah. So, nobody likes it.
No.
Somebody, how to prevent Botox resistance in the long run? We actually answered this question right at the beginning, but we just said that leaving a good space in between sessions is kind of the main thing, and then also changing Botox type as well. So if you go from Allergan Botox to Dysport maybe, or see them in some of these other brands that can help.
Apparently I'm looking flawless. I think it's just the ring light.
Compared to me anyway.
It's the ring light and I don't know, the kind Instagram filter. I think that's all it is.
That's it.
Well,
cool. Thank you very much, Sarah.
Thank you for having me.
Nice to speak to you.
It was fun.
We managed to get an hour out of that, which is quite impressive.
And good value.
First time. That's it. Yeah. Exactly. I'll see you on OnlyFans later.
I'll see you later.
We're doing a Jill session together. So. Okay. Cool.
Bye.
Bye, Sarah. Bye. See you guys. Bye.